As San Diegans head to the polls today, voters are being asked to decide on different ways to address important issues like mental health, the homeless crisis, and how to help our veterans. But where can military families turn when they need help right now? We are working for you to get some answers because you matter. Joining me now is Christina Pineda, Program Manager of Courage to Call, to tell us what they do to support military and veterans right here in our community. Christina, thank you so much for coming in. We appreciate your time.
Yes, you're welcome.
Tell us a little bit about Courage to Call for people who might not be familiar with this program.
Yeah, so Courage to Call is an organization under the Turn Behavioral Health Services umbrella. We are a nonprofit organization funded by the County of San Diego. We contract with 211 and we provide services to veterans, military reserves, National Guard, and their families.
Are these mostly mental health services or grief counseling services, or is it really a wide scope?
It's a wide scope of services that we provide. Our 211 agents are veterans themselves. They're our peer support specialists. They take our calls, and they get calls anywhere from a need of housing and a need for mental health services. It could be resources in the community. It could be as simple as car repairs.
Okay, so it really does help any member of our military. I mean, you think of the men and women who come here and they're stationed here, and they don't know north from south at this point, where things are, where to go, housing, doctors, all that good stuff. This is where you guys come in.
Yes.
Fantastic. Well, thank you for getting involved. As far as the mental health aspect of this, tell me a little bit about that and some of the peer support members that are a part of this too.
Yes. So Courage to Call, we're fully staffed by veterans or family members of their veterans. One of the components of our organization is that we have a clinical staff that provides solution-focused brief therapy. And what we do with this modality is we help the service member or the family member that's receiving the service get into more long-term care solutions.
Oh, that's great, and that's so needed, especially for many of our veterans,
Yes.
those who have fought and served in this country. As far as the types of calls that you get, you kind of touched on this a moment ago, but people not afraid to pick up the phone and call. I mean, at least you can point them in the right direction.
Yes.
And as far as the issues that local military families are facing, for those of us who may not be super familiar for what these families are up against, what are they dealing with specifically here in San Diego?
I think one of the biggest issues that we're seeing is housing, right? We know that there's a housing crisis out there. Another one is access to mental health services. And one of the other ones that we've been noticing a lot lately is transitioning. There are transitioning resources out there, but it's not getting out to the veterans that are transitioning out. And our goal is to make them aware that there are resources that are available to get them before they transition out, to prevent some of the struggles that we're seeing today.
Yeah, because people who go from an organized structure day to day, have to be somewhere, have to answer to someone, to nothing.
Yes.
That is so jarring for so many young men and women, and this is where Courage to Call comes in. The number for people to reach, because it is a number and it's actually open, what, 12 hours a day?
Yes, it's open 8 a.m. to 8 p.m. and the number is 1-877-MY-US-VETS. They can also access a chat through our website where they can get contact with a live agent.
Okay, fantastic. 1-800-MY-US-VETS. And you're going to reach somebody from Courage to Call right there. You can also call 211 if you need to, and they'll definitely connect you with Courage to Call. Christina Pineda, thank you so much for coming in. We do appreciate your time.
Thank you.
Thanks for what you're doing in our community too.
Thank you.